If you're watching this, chances are you already know the isolating struggle of polycystic ovary syndrome. You're dealing with the unpredictable periods, the unwanted hair, the acne that never truly clears, and the constant, nagging feeling that your body is working against you. Maybe you've lost count of the times you've had to cancel plans because of pelvic pain or felt deeply misunderstood by doctors and even family, constantly questioning what's normal and what's a sign of something more serious. It's an exhausting reality, and for women with PCOS, there's a quiet, critical conversation we need to have about a deeper concern that often gets overshadowed by the everyday symptoms of the syndrome itself. The silent, subtle warnings of ovarian cancer. Good news, having PCOS does not mean you will get ovarian cancer. But the journey of having a chronic complex reproductive condition like PCOS means you are already attuned to your body in a way many others are not, and this awareness is your greatest ally. In today's video, we are going to walk through the 10 most critical, yet easily overlooked, warning signs of ovarian cancer that every single woman with PCOS must know, because early detection can change everything. So stick around, because recognizing these subtle shifts is not about fear. It's about power, advocacy, and protecting your future health. Before we get started on this crucial topic, I'd love to know where you're joining me from today. Drop a comment below and feel free to ask any questions you have about managing your PCOS or your concerns about your health. Your engagement helps us create a supportive community right here. And don't forget to hit that subscribe button and turn on notifications so you never miss a health-boosting tip from our safe space. First, let's talk about why this conversation is so important for us, the women who live with PCOS. The reality of living with PCOS is that it trains you to dismiss discomfort. You are conditioned to accept irregular periods, bloating, and pelvic pain as just part of it. You've heard it from doctors. You've read it in forums. And maybe you've even told yourself, this is my normal. But what happens when that normal shifts, even slightly? This is the heart of why we must talk about ovarian cancer. Ovarian cancer is notoriously difficult to diagnose early because its symptoms are often vague and can easily be mistaken for common, everyday issues or even for the very symptoms of PCOS itself, like bloating or pelvic discomfort. This isn't your fault. The medical community acknowledges this challenge. But for us, understanding the subtle differences and knowing when to push for answers is paramount. You are not alone in this struggle. Thousands of women live with PCOS, and the anxiety that comes with trying to distinguish between a hormone-related flare-up and a real red flag. This feeling of having to constantly analyze your body is exhausting and can lead to emotional burnout and a deep sense of isolation. However, this is precisely why we must equip ourselves with knowledge, turning that hyper-awareness into a protective shield. We are preparing you now to be your own most informed advocate. And by the end of this video, you will have a clear, actionable list of signs that demand attention. Signs that are different from the baseline of PCOS discomfort. Remember, knowledge is power, and we are on this journey together, preparing you for solutions and security. Our first critical warning sign is persistent and noticeable bloating, not the temporary, post-meal bloating that comes and goes, which is a common complaint for many women, including those with PCOS. This is different. It's bloating that is persistent, meaning it happens most days and lasts for weeks, often with a feeling of abdominal swelling that makes your clothes fit differently. Ovarian cancer can cause fluid buildup or tumor growth, leading to this continuous distension. Can a little gas-relieving tea fix this? While it might offer temporary relief, if you have this kind of persistent, daily bloating that isn't connected to your menstrual cycle or a specific dietary issue, it's a red flag that you must discuss with your doctor. The key here is persistence. You can track it by making a simple note on your phone every day it occurs. If it's happening more than 12 times a month, it needs investigation, but that's just the beginning. The next sign is even more insidious because it targets one of our most fundamental needs. Can I ask you something personal? How many times have you felt completely alone, unable to understand what is truly happening with your body, like no one around you could possibly comprehend the depth of your struggle with PCOS. I know how deeply that isolation hurts, and I want you to know with absolute certainty that you are not alone in this fight. If you feel this way, take a deep breath and leave a comment right now saying, "I understand this struggle." Write exactly that. Your message can give strength to another woman who is going through the very same thing and needs to know she is not by herself in this journey. The second sign is what doctors call early satiety, which simply means you feel full after eating only a small amount of food, or you experience a significant loss of appetite. Think about it. You sit down for a meal, maybe you're even hungry, but after just a few bites, you feel uncomfortably full, as if you've eaten a huge feast. This happens because a tumor on the ovary can press on the stomach and surrounding organs, making you feel physically full sooner. Can simply changing your eating habits fix this sudden shift? While mindful eating is always helpful, a dramatic, unexplained change in your appetite is a systemic issue, not a simple behavioral one. If you find you're skipping meals or struggling to finish even small portions for most days over a 2-week period, it's a warning sign to take seriously. Keep a food diary for a week, not to diet, but to document exactly how much food is making you feel full. This provides your doctor with concrete evidence. Before we continue, if this information is helping you find clarity and empowering you to take charge of your health, hit the like button and subscribe so you never miss any of our upcoming tips. This information is vital, and the third sign is one that you may already be dismissing as mere exhaustion. The third warning is a deep, unshakable fatigue. We know all too well that PCOS can bring a unique level of exhaustion, from insulin resistance-driven energy dips to the sheer emotional drain of managing the condition. But this is a fatigue that is different. It's extreme. Persistent tiredness that isn't relieved by rest. A bone-deep exhaustion that makes even simple daily tasks feel monumental. It's the kind of fatigue that can be a general symptom of cancer, as the body expends huge amounts of energy fighting the disease. Is this just another side effect of stress or a bad night's sleep? While those factors contribute, this level of debilitating tiredness is often described as a new normal of exhaustion that wasn't there before. If you find yourself needing to nap daily, struggling to stay awake during the day, and it's lasting for weeks without explanation, you need to bring it up. Start documenting your sleep and energy levels on a 1-10 scale. This data is the currency of advocacy with your doctor. But the fourth sign involves a bodily function that often gives women with PCOS trouble anyway, making it particularly easy to overlook. Our fourth crucial sign involves changes in your urinary or bowel habits. For the bladder, this means a new need to urinate frequently or urgently, feeling like you constantly need to go, or waking up multiple times at night when this wasn't your routine. For the bowels, it can mean persistent constipation or sometimes diarrhea. The proximity of the ovaries to the bladder and colon means that a growing tumor can directly put pressure on them, interfering with their normal function. Can drinking more water or taking a fiber supplement solve this? If the issue is persistent and coupled with other signs, it may be due to pressure from the ovaries, which simple lifestyle changes cannot fix. If you are experiencing these symptoms more than 12 times a month, it warrants a deeper look. Track your bathroom trips and any changes in your stool consistency for 2 weeks. But there is a fifth sign that is the most confusing for us, because it's a core symptom of our baseline condition. The fifth sign is persistent pelvic or abdominal pain. We all know what period pain and pelvic discomfort feel like. It's often a regular part of having PCOS, especially if you have cysts or chronic inflammation. But the pain we're looking for here is a new, persistent discomfort that is not relieved by your usual pain management methods or your period starting, ending. It may feel like a constant pressure or a dull ache in your lower abdomen or pelvis. The key is that this pain is lasting for weeks and isn't fluctuating with your cycle, or it's simply a new type of pain you haven't experienced before. Does this mean every cramp is a cause for panic? Absolutely not. But if you have persistent discomfort for most days over 2 weeks, it is time for a conversation with your gynecologist. Keep a detailed pain log. When it started, what it feels like, sharp, dull, pressure, and what makes it better or worse. But this next set of signs reinforces our credibility and why you must trust your gut. We need to bring in some clarity and authority right here to reinforce the seriousness of these signs. Leading health organizations and cancer specialists emphasize that the symptoms of ovarian cancer are often subtle, which is why they are called the silent killer. The most critical factor is the persistence and frequency of these symptoms. The American Cancer Society explicitly states that if you have symptoms like bloating, pelvic or abdominal pain, trouble eating, or urinary symptoms more than 12 times a month, you must see a doctor. This is not about being a hypochondriac. It is about following clear medical guidelines to ensure the best possible outcome. For women with PCOS, we already have a higher baseline for many of these symptoms, which is why your detailed tracking and your ability to recognize a new normal is your most powerful tool in self-advocacy. You must feel empowered to demand attention when your body tells you something is wrong, especially when you have documented proof of persistent changes. We are building a defense for your health, and the next few signs cover changes that are easily blamed on stress or diet. The sixth sign is an unexplained, persistent back pain, particularly in the lower back. This kind of back pain is not due to a muscle strain from lifting something heavy or sleeping in a strange position. It's often a constant, dull ache that can be a radiating pain from the pelvis. This can happen as the tumor grows and presses on nerves or surrounding structures, which can be felt far from the ovaries themselves. Can stretching or physical therapy fix this pain? If the pain is coming from an internal mass, no amount of external therapy will solve the root cause. If the pain is new, persistent, and not explained by injury, include it in your symptom log. The seventh sign is new or increased pain during sexual intercourse, medically known as dyspareunia. While pain during sex can be caused by many things, hormonal imbalances common in PCOS, dryness, or even deep-seated pelvic tension, a new, persistent, or worsening deep pain can be a warning sign of an underlying issue, including a tumor mass. This is an incredibly personal and often embarrassing symptom to discuss, but you must overcome that barrier for your health. If this pain is a new occurrence, especially if it's accompanied by other signs on this list, it needs to be part of the conversation with your doctor. Our eighth sign is significant, unexplained weight loss. For a woman with PCOS, weight gain and the struggle to lose weight are often a reality due to insulin resistance. So, if you suddenly begin losing weight without intentionally changing your diet, exercise, or lifestyle, it should raise a serious concern. This can happen because the cancer is consuming the body's energy, or causing the loss of appetite and feeling full quickly. Is this simply a metabolism boost? While unexpected weight loss might sound like a dream to someone struggling with PCOS-related weight, rapid, unintentional weight loss is a medical symptom that needs to be investigated immediately. Keep track of your weight. And if you've lost more than 5% of your body weight over the past 6 to 12 months without trying, share that number with your healthcare provider. The ninth sign is a change in your menstrual cycle. For us with PCOS, irregularity is the norm, with missed, very light, or long cycles being common. However, a change from your established pattern, even a chaotic one, is what matters. This could mean more frequent periods than your usual irregularity, or unexplained bleeding or spotting between your already irregular periods. If you are postmenopausal and experience any unexpected bleeding, you must see a doctor immediately. Can this be easily dismissed as just another PCOS fluctuation? While it could be, any sudden or significant shift in bleeding pattern needs to be ruled out as a more serious concern. Pay close attention to any bleeding that is new or different from your usual chaotic cycle. The 10th and final warning sign is persistent indigestion or nausea. Many women with ovarian cancer report a nagging, upset stomach that isn't relieved by antacids or usual remedies. This is another symptom that can be mistaken for simple acid reflux, a stomach virus, or even stress. However, when it's persistent, happening most days over a period of weeks, and especially if it's combined with early satiety, it becomes a critical sign that an internal issue is affecting your digestive system. If you made it this far, it means you are searching for answers, for relief, and for hope. And that is a powerful step. This channel was created exactly for that, to help you understand your body, to regain control through informed self-advocacy, and to find solutions that actually work for your PCOS. Please know, you are not alone here. We are building a safe space where women like you can find support, community, and real, actionable information that makes a profound difference in your daily life. This isn't just a channel about a diagnosis. It's a community dedicated to your total well-being. If this is the kind of guidance, support, and informed conversation you've been looking for, subscribe now and turn on the notifications. Every video is a step toward a healthier, happier, and more empowered you.